Hard work pays off. The harder you work, the more people will notice. You are watching The Last Mile with NACA, and I am Adesu Alsi. Welcome. Results from the alignment agreement between the federal government, the Global Fund, and PEPFAR has informed visits from other African countries to Nigeria. This episode features a recent visit by a delegation from Kenya. Don't go away.
Nigeria, through the leadership of the National Agency for the Control of AIDS, NACA, has recorded several landmark achievements in the HIV and AIDS response, especially from 2015 till date, with significant reduction in morbidity and mortality rates, as well as more people living with the disease placed on treatment. For this, various innovative approaches were employed, but noteworthy is the HIV alignment agreement between the Government of Nigeria, United States President's Emergency Plan for AIDS Relief, PEPFAR, and the Global Fund.
Over the last 3 years, we started alignment of our HIV program. What we do basically is to bring all the stakeholders under our roof, having one national HIV response. And what that means is there should be no co-location of services given by Global Fund, PEPFAR, or Government of Nigeria. There should be no duplication in our supply chain, and because of that, our resources are pulled together. We have one unified supply chain system. We have a standardized treatment package that is found across all service providers in all locations. And we have increased investment from government. The reason why we're doing this, or we started this, we're looking at country ownership and sustainability. And we need to start from somewhere. These are areas that we believe at that time, if we begin and succeed in bringing the entire program providers under our roof, under one national HIV response, then transitioning to government and giving the responsibility to government entities at the state level and at federal level is not going to be too difficult.
With the results achieved in the first phase of the alignment, parties involved are set to commence the second phase.
I'm happy to say we have succeeded in the alignment 1.0. We are now moving to alignment 2.0. And the alignment 2.0 is looking at what are we going to do as the donor agencies that provide majority of the funding that we use for HIV program begin to shrink. Who takes the position or the place of the donor agency at the shrink? And that was the basis of the HIV Trust Fund we established earlier in the year. And we're looking at integration of our services with malaria and tuberculosis, especially at primary health level, and also health insurance system that will guarantee services for people living with HIV/AIDS wherever they are treated in the country. And this is in addition to seeing the states being driving these programs at the respective sites, meaning we will be putting more states in the driver's seat. We will be given the state's responsibility of driving the program for treatment and prevention, and with time also supply chain. And after some period of time, we now integrate all this together, including the data that are collected from the state and that are sent centrally to our national data repository.
This has informed visits from some African countries to NACA wanting to understudy Nigeria's activities. The latest of such visits was a delegation from the Center for Disease Control and Prevention, Kenya and Nigeria.
We're very happy to receive colleagues from other countries as we have been doing at the same time. And we're also happy that Nigeria is identified as one of those countries that sister countries can come to share notes and look at what we do, and we learn from the activities that we've been doing together for the last 20 years.
Thank you for receiving us. So I'm here with me is a team from Kenya. We actually have been having some engagement with them, which is for South-to-South learning, which actually started over 2 to 3 months ago in June. So we've been learning from one another as countries virtually, but we had agreed that they would also come in countries so that we can continue further in terms of sharing of knowledge and experiences and comparing notes regarding our programs. And we thought it was very pertinent that we make sure we had a touch with you and your team so you can highlight what we are out here to do and they are out here to do, and also what we hope to achieve.
Thank you so much, sir, for welcoming us, and we are glad to be here. We are here because of the good work we have had and seen through the results that you have posted, especially in treatment and other areas. And for a long time, we have had Nigeria coming to Kenya, and we did not have an opportunity, or we did not have a chance to come. So we think these are very great opportunity for us to come. And when we look at what they have achieved, we are very clear that they could not have achieved without collaborating with the government. And therefore, we thought it's good for us to also be able to come and listen and hear how the government have been working with our team. In Kenya, we have a kind of a similar structure. We have the National AIDS Control Program, and then we also have, we don't call it NACA, we call it National AIDS Control Council, which is similar to what you have here, and we work very closely with them. So we look forward to a great collaboration with you, and we are also willing to share our, what we have, but more so we are looking forward to come from you. Thank you.
For us, this is probably the first of several ways in which we're going to be opening up our program. The Nigerian program has gotten a lot of accolades, both globally, and one of the positive spin-offs of that has been really being able to demonstrate the success across the 395s, particularly our treatment program, as we're nearing treatment saturation. For Kenya, we're equally excited to host them because Kenya is one of the 20 PEPFAR countries that have been able to demonstrate epidemic control. And for us, we saw this as a critical opportunity for us to get learnings, not just from the Nigerian end, but also from the Kenyan end, and how they've really been able to stand up not just epidemic control, but sustain epidemic control.
We know that data plays a critical role in tracking our progress towards epidemic control. For a number of years, we have been dependent on aggregate level systems, but as you near epidemic control, you don't want to focus on just aggregate. You really want to be sure that you are counting unique individuals who have actually received the services that they need to, and they have the outcomes that are expected of them, and not only just outcomes, but more sustainable outcomes. So as we come here, one of the things that we are very interested to learn more about is the National Data Command Center, the situation room, really seeing how data has played that critical role in this treatment revolution in a more sustainable manner, even as you heard, towards epidemic control. So we appreciate the opportunity to learn from you and also share our experiences, and we hope that through this South-to-South, both countries will become better from both data and program perspective.
From the conference room, the delegation moved to the Data Command Center, domiciled in NACA.
The meeting with the Director General was excellent. We were able to appreciate some of the specific things that you are looking at. One, in terms of sustainability of the program, which is something that Kenya is quite keen on and has done some work through working directly with our county governments as well as our national government. Currently, health in Kenya is devolved to the counties. I think that's the equivalent of your state governments. We also learned, from the visit about your very nice command center, which is something that we will immediately take home. You have the ability to have different dashboards, whether it is from the NDR or whether it is, the other, system that is able to pull data right from the sites. For us in Kenya, we have what we call the National Data Warehouse. I think you have a better coverage of the EMR. We had, it's about probably 98% we had. I think you're able to appreciate the data that is coming from facilities as well as coming from, the National Data Repository, through a central place. And I think that's something, that we can implement, through a dashboard.
Right here we have data that shows the summary of activities of different sectors that are all helping to control HIV/AIDS epidemic. We have the data from health sector and we have data from non-health sector. So we were able here to show them the data that came from the health sector, meaning all the facilities that are reporting data to the national center, meaning to Federal Ministry of Health and NACA. So the summary shows on the dashboard of the testing and how many people were able to place on treatment. But the main thing is how many people was Nigeria able to maintain on treatment to reach close to 100%. So closing the gap as much as possible to see the expected number of people who are living with HIV and what portion of this are we able to place on treatments. So like this one, this data we showed them is more of an aggregate data, but there's a patient level data, meaning it is coming from individual patients on the National Data Repository. And this is one of the things that we're able to show them over here.
I think, for us, we did see that there were variations in terms of what's coming from facilities directly and then what's coming from the National Data Repository. And I think, one thing we have also tried to do is to really align our data, from what is, what comes through facilities and what is, coming through the national system. We call it KHIS, Kenya Health Information System. So we've tried to align it to some degree of success. I think right now it's about 95% concordant rate. And I think it's just that, working together with government, ensuring that, the sites reporting report the same data to the different platforms. So it's probably something that we can share on exactly how we did it. But in terms of just, having a central place that has all these dashboards that you can look at, that the leadership can make decisions quickly, I think it's something that we can definitely take home and implement in Kenya.
For Dr. Masamaro, visits such as this opens up numerous areas for collaboration.
There are many opportunities to collaborate together. I think looking at your epidemic and looking at ours, they're not very different. One is that beyond, looking at continuity of treatment, which is important, I think there we can learn together, can share experience, can improve our program. But one striking thing is just you have an aging cohort of patients or individuals on treatment, and it's something that we're also experiencing. With an aging cohort comes, certain non-communicable diseases. And I think that's a platform that we can share, one, models of integration, but also models to think about how to deliver those services beyond even when PEPFAR is not here. How can we finance, screening, diagnosis, prophylaxis, follow-up and treatment through innovations like, whether we want to do health financing, insurance, either tax-based or social insurance. And I think there are many ways to do it, many models to look at it. And I think, building a community of practice along those lines would be important.
Now, seeing the success that Nigeria has achieved, other countries globally are advised to come to Nigeria and learn from Nigeria what Nigeria has achieved in terms of our alignment of HIV program and our plan for sustainability and country ownership. That was why Namibia was here last year. And this year you have seen delegation from Ethiopia as well as Kenya. More countries are expected to come to Nigeria to learn how to have one single national HIV program that encompasses all stakeholders and that prepares to put the government in the driver's seat and also promote country ownership.
As the result from the combined efforts of the government of Nigeria, the Global Fund and PEPFAR through the alignment continues to resonate even outside the continent, NACA and its stakeholders are poised to do more towards achieving and sustaining epidemic control by 2030.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
The update segment brings you highlights of NACA and stakeholders' activities in the country and elsewhere. Keep watching.
Staff of the National Agency for the Control of AIDS, NACA, and Nigeria Correctional Service recently took part in a 5-day capacity-building workshop on fundamentals of monitoring and evaluation and data analysis. The workshop, which was supported by the United Nations Office on Drugs and Crime, UNODC, aims to sharpen the data gathering and processing skills of participants. The Director, Research, Monitoring and Evaluation, NACA, Dr. Greg Ashefo, spoke further on the purpose of the training.
The training is on basics for monitoring and evaluation, fundamentals, and equally data analysis. Data remains data until it's transformed to information. And information it cannot be anything except it's used for planning, for programming, for decision making. So that is why this is very important for our staff. So after this, it is expected that our staff will have the skills to do proper analysis of data, the various data that we have from the various data sources. You look at in the past, we've done so many surveys. We have so many, over close to 2,400 facilities are sending data, both for health sector and non-health sector, and all these are available. But these are not available in the shelf, but are not being used for evidence of a decision, for planning, for programming. So this training is very important. We actually build the capacity to do that, build the skills to do that.
Commending the organizer of the workshop, some participants shared their thoughts and experience.
We have come and we have seen, we have witnessed a lot of things here. We have gained a lot. I have to thank my department as well, my DCG in particular, to coordinate between the department and then UNODC. I'm really very grateful. In fact, the training is really very good. We have gained a lot of knowledge.
What we've done here has been very interesting. I want to thank all the participants here. We've been so wonderful. It's been a bit tedious, but we enjoyed it. We enjoyed every moment we spent here. And we hope that we'll come back, most especially for the manuscript writing and the abstract writing, because I personally would want to learn more on that. Thank you.
When I came to NACA, very recently when I came there, we were sent on a DQ exercise. So when we went to the field, I understood the job, I understood what they were doing, but I didn't know, I was just wondering, how did this tool come about? Who made it? That was my question. I kept asking the person I went with. So now Mr. Toby has explained their measures. It didn't just fall from the sky. But thankfully now I understand the whole concept. There are procedures put in place to get to it. So thank you very much to all the organizers, the facilitators, everyone. Thank you so much, and hopefully we'll have more of this. Thank you.
Monitoring and evaluation, as well as data analysis, are essential tools for programming and policy formulation in the HIV space. This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and NACA. For more inquiries, call the NACA Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact NACA Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear, or the white result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support NACA and the fight against HIV. Know your HIV status today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching. And as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. avoid indiscriminate sex. And lastly, know your status and take action. So next week on The Last Mile with NACA, I am Ade Suwelsi. Goodbye.